Tanner, I know a big part of your work is somatic tracking. Can you tell us, why it's a useful tool for people with chronic pain? And then I heard you might also be interested in walking the group through a somatic tracking experience.
Yeah. Um, so yeah, somatic tracking is definitely a part of pain reprocessing therapy, and typically the response to pain, right? And it is the human response, right? Is there's fear, frustration, anxiety, despair, sometimes preoccupation or intense focus on it, right? Um, and so a big piece, especially early on in PRT, is to change the relationship like with the pain sensation. And so, what we're trying to do using somatic tracking is have people's fear of the pain actually reduce over time. And in doing so, they start to actually view the pain, what we kind of call like through like a lens of safety. So really what this is you're viewing the pain with lightness, ease, and like curiosity and interest, as opposed to the fear and frustration that might naturally come, right? And we know like using these techniques within kind of the package of like psychological techniques in PRT is really helpful in exiting people out of kind of like a pain fear cycle. And then as a result, over time, the pain symptom can start to reduce or dissipate as the relationship with the symptom, pain or otherwise, starts to change. And so, yeah, I kind of explain it. It's very similar to like exposure, right? So, in terms of other therapy, like we do exposure all the time, like with social anxiety, we slowly expose people to social situations as they kind of feel safe. And so, it's the same idea um, with somatic tracking, is we're slowly exposing them to the pain sensation, but in a different way where they're responding to it differently. And so I can go through one now.
Great.
As I'll kind of say before I get started, you can follow along if you like. But really somatic tracking is supposed to be meant for kind of like more mild to moderate symptoms, right? Because we don't want to, it's really hard to focus kind of through that lens of safety when the symptom is too high. So there's no need to follow along if that's where you're at today either. Um, so what I'll have everyone do if you're comfortable is you can, close your eyes or lower your gaze. And what I want you to start off doing is just take a few deep breaths in and out, just slowing it down. And to start off, just, scan your body and notice where you're feeling these sensations right now. Notice what body part they're in, where they're kind of located, and if the sensation is localized or widespread, and really, just describing it a bit, right? Is it burny, tingly, pressury, stabby? Just exploring like what the sensation is doing. And I want you to focus in on it, but I'm careful here. I don't want you to focus in on the sensation like you're studying for a test right now. We're not criticizing it or scrutinizing it or trying to make it do anything or change. So just keep slowing down your breathing with each exhale, just kind of reducing the pressure, taking it off, and just allow yourself to explore it almost like if there was like a curious little puppy in your room right now. If there was a curious puppy in your room right now, it would be toppling over things, exploring things, and just have this light and easy attitude with it. So just kind of, watching the sensation and noticing what it does. Does it increase, decrease, move, or change in any way? Again, it doesn't matter too much. We're just getting some practice responding to it differently right now. And I know right now it feels like something's going on in your body, but all your muscles and tendons are healthy. And all your ligaments and nerves are perfectly intact. All that's taking place is a safe, normal, neutral sensation. It's just your brain has been misinterpreting things for a long time due to feeling in danger. But right now, you're safe to just experience the sensation, explore it a bit, and watch it in this way. And I kind of explain it to people, it's kind of like when you're at an aquarium. Because, when you're at an aquarium, aquariums are pretty fascinating. There's a huge glass wall, and you're able to safely, kind of be detached from your sea life and just watch them in this way. And so just allowing yourself to really almost watch the sensations, kind of like sea life in the aquarium, but almost like you would, like a young child would watch at an aquarium. And this kind of fascination, just noticing and recognizing you're safe to just watch in this way. And what do you notice taking place? Are the sensations increasing, decreasing, moving, or changing? Again, whatever they're doing is completely fine. So what I want you to do is just take a few more deep breaths in and out. Just allowing yourself to feel the nice release of the exhale. And when you're ready, you can come back to the room. And that's a somatic tracking. A quick reminder,
Yeah.
that's a somatic tracking, yeah.
How do I get my therapist to do that?
Yeah.
No, just kidding. She's great.